50 years, the John A. Burns School of Medicine has sought out students from disadvantaged backgrounds through its ʻImi Hoʻōla program. It's a boot camp of sorts that helps students prepare for the rigor of medical school.
I'm from Waianae on the west coast of Oahu. I graduated from the Kamehameha School's Kapalama campus, and I'm a first-generation college student, but was afforded the opportunity to go to Stanford, and that's when I applied for the ʻImi Hoʻōla Post-Baccalaureate Program.
So let's talk a little bit about the student learning objectives. We want to learn about Hansen's disease. We want to look at the psychological, sociological impact. ʻImi Hoʻōla means those who seek to heal, and it is one of the most aggressive and innovative programs established here at the John A. Burns School of Medicine at the University of Hawaii. It has been in existence for 45 years and was created to make sure that Native Hawaiian, Pacific Islander students and other underrepresented groups have access to careers in medicine. We accept up to 12 students for the year-long program, so students from educationally, socially, and economically disadvantaged backgrounds are given that opportunity. It is quite academically rigorous, and once they complete our program, they become medical students.
The ʻImi program has helped me tremendously. I felt very prepared for medical school. It gave me a family, people that I could really rely on, a great support group, and I feel like I'm a much better prepared physician now that I'm in residency. I hope to one day come back to the West Side and especially help out places on Oahu that are underrepresented and underserved.
We've been very proud of the success of our graduates. Currently, we have 267 graduates from the program who went on to become physicians. 80% of those in practice have chosen primary care, so practices such as family medicine, internal medicine, and pediatrics. Those are the providers that are the first line in the communities and are really needed. The program is supported by community donors. One of our largest donors is the Queen's Health Systems. They provide monthly stipends so that students can focus on their studies and they don't have to work while in the program. We also have a nonprofit called the Friends of ʻImi Hoʻōla, and that, along with individual donors, help to support the program. Should someone wish to donate money to the program, they can simply go online to uhfoundation.org.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
We're in this van that's technically a medical clinic on wheels. It goes all over Oahu to treat the underserved communities. And today we're going on a ride-along to Kaka'ako.
I started H.O.M.E Project in 2005. H.O.M.E Project stands for Homeless Outreach and Medical Education, and it is a free clinic for the homeless, both sheltered and unsheltered. And it combines medical services for the homeless, but also education for the medical students at the John A. Burns School of Medicine. We can do acute and chronic care, we do preventative medicine, advanced wound care, free labs. We have a lot of lab equipment on board. We also have an ultrasound machine, and then we have an exam table in the back if we need to do private examinations, and all of it is provided for free. We started off just with one clinic. Now we have 9 sites that we go to. Here in Kaka'ako, the homeless in this area are local and Micronesian families. We see a lot of wounds, but in addition to that, we see a lot of what normal clinics see. So we see a lot of diabetes and hypertension. There's a fair amount of asthma in this population. And then just kind of like, the common cold.
Nice to meet you, Jake. So how are you doing today?
I did okay.
A lot of the patients are very respectful. They show a lot of gratitude and they're really appreciative. of the care we give them. I've been volunteering for the H.O.M.E project for the past 4 years at our Hope Shelter Kalailoa Clinic. One of my most memorable experiences I had with the H.O.M.E project was being able to help one of my friend's parent out who was a resident at one of the shelters we're at. You gain a deeper sense of empathy and care for patients. Just really hearing their stories and how people just fall on hard times sometimes, it really motivates me to just want to give back and want to be that helping hand for people who are in need.
Since the start of H.O.M.E project, we've helped a little over 5,000 individuals and over 10,000 patient visits. My ultimate goal would be for us to become obsolete. It would be great if there was no need for our services anymore, but I don't see that happening in the near future. So our short-term goal is to be able to help as many communities that need help. We don't get any funding from the state or the city. All of our funding comes from grants or donations from the community. So we are having a fundraiser on January 19th at Central Union Church, Hoʻōla Post-Baccalaureate, and it would be great if anybody from the community wants to come out and support us.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.